and thank you for joining us. We have with us today Minister Shandro, Minister of Health, and Dr. Laura McDougall, Senior Medical Officer of Health with Alberta Health Services. Minister Shandro will start.
Thank you. Good afternoon, everyone. I want to update you today on a development that is related to the COVID-19 vaccine. Since early on, Alberta has been a national leader in the vaccine rollout. Together, the Ministry, Alberta Health Services, and the Vaccine Task Force have worked hard to make sure that we're getting doses into the arms of Albertans as soon as we receive them. That's why we have now administered more than 74,000 vaccines. And we're on track to have a capacity to give out 50,000 doses a week, if not more, by the end of January. We are a model for the rest of Canada, and I could not be prouder of the work that is being done by both the folks in the ministry and at AHS. However, we need vaccines. That is the bottleneck that we are facing as we work to ramp up both the number of doses that are administered and the groups that we include in the vaccine distribution. Today, we received another blow. Pfizer has indicated to the federal government that there will be a temporary delay in vaccine shipments due to expansion plans at their European facility. Pfizer is retooling one of its production lines to increase overall production from 1.3 billion to 2 billion. Now, this means that Pfizer is temporarily reducing deliveries, they've told us, to all countries that are receiving vaccine that's manufactured at its European facility, and that includes Canada. This temporary reduction in supply could see deliveries to all countries being served by Pfizer's European facility reduced in the coming weeks. Shipments are expected to continue in the coming weeks, but the number of doses will be fewer, we are advised. Pfizer believes that by the end of March, it will be able to restore supply so that Alberta can be on track for the total committed doses for Q1, for the first quarter of this calendar year. Now, while unfortunate, such delays and issues are possible when global supply chains are stretched and pushed and demand is high throughout the rest of the world. This means that next week, the amount of vaccine that Canada receives will be reduced by about 20%. The week after that, the trays that we receive, remembering that we receive the Pfizer vaccine in a tray, much like a pizza tray that holds the vials, each vial having 5 doses each of those vials. And the number of trays that we will receive that week will be reduced by 80%. And then the 2 weeks that follow, we will see only half of the expected doses entering into Canada. We are waiting for more information from the federal government about how this will affect Alberta's allocation of vaccine for the coming weeks. Now, this is out of our control, but it will impact Alberta's immunization schedule. As a result of fewer doses of vaccine coming into our province, it will take longer to complete immunization of the priority healthcare workers who are currently part of Phase 1. It will also delay our ability to start immunizing all seniors over the age of 75, regardless of where they live, and all Indigenous seniors who are 65 years and older. We had hoped to announce the start of these vaccinations in the coming days, but that is now in question. AHS has been significantly ramping up their distribution capacity based on the forecast schedule of delivery from the federal government. Remembering that, again, it is the federal government who tells us when and how much vaccines we receive. This work will continue so that we're ready when doses do arrive, but it will mean more people are on standby, waiting. And this is unfortunate news, and we are all disappointed. However, we will not stop. We just will not stop. Health officials will continue giving out what vaccines we do have as quickly as possible. We will continue focusing on vaccinating all residents and staff in long-term care and designated supportive living throughout the province. And I expect that we will have all of these facilities completed by Monday. And we will continue immunizing healthcare workers as quickly, as safely as possible. Most importantly, our province will continue being a leader and keep expanding our capacity so that every dose that is arriving is being put into someone's arm as fast as possible. Thank you, and now just to remind folks, Dr. Laura McDougall, the Senior Medical Officer of Health, we have a Chief Medical Officer of Health, obviously, in the province. We have many medical officers of health throughout the province as well, and thank you to all of them who are doing an amazing job responding to the pandemic and protecting Albertans. Many of them work within Alberta Health Services, and the most senior of them is the Senior MOH, and that is Dr. McDougall. And Dr. McDougall, if you could come to the podium, please.
Thank you, Minister Shandro.
Good afternoon, everyone, and thank you, Minister, for inviting me. Alberta Health Services has been working with Alberta Health since last year to put a provincial vaccine rollout strategy in place. The provincial COVID-19 immunization program began on December 14, 2020, and continues to be rolled out province-wide. That means that in just 1 month, AHS has provided healthcare workers and long-term care and supportive living residents with more than 74,000 doses of COVID-19 vaccine. AHS continues to do everything possible to immunize as many people as quickly as possible with the available resources. We began the immunization program focusing on residents of long-term care facilities as well as designated supportive living sites. We focused on those staff and physicians who support acute care and other high-risk patients to protect populations at highest risk of severe outcomes. As more vaccine became available in Alberta, we began expanding those groups. Currently included are respiratory therapists, healthcare workers in intensive care units, staff in long-term care and designated supportive living facilities, home care workers, healthcare workers in emergency departments, and all residents in long-term care and designated supportive living, regardless of age. As well, healthcare workers in COVID-19 units, medical and surgical units, and operating rooms, as well as emergency medical services. To date, because of the hard work of our healthcare workers across the province, AHS has accelerated our immunization rollout, and we've been able to deliver vaccine much more quickly than expected. We did this through active recruiting of additional staff to join our team of immunizers, including other healthcare providers, healthcare retirees, undergraduate nurses, and community pharmacists to provide immunizations across the province. We also created pop-up immunization clinics in emergency departments so we can bring more immunizations to the front line. We created an online booking tool for eligible staff to book their immunization appointments online, and have also had text notification systems reminding staff to book in. And we've opened up hundreds of appointments and are filling these appointments fast across the province. We have enough immunizers and more than enough people wanting to be immunized. What we need is more vaccine. If and when more supply becomes available and delivery schedules more regular, AHS will be able to immunize more healthcare workers and eventually more Albertans. Our ability to deliver immunizations is always contingent on the vaccine supply that arrives in our province. We understand that healthcare workers and Albertans who are not able to receive immunization at this point may be disappointed and anxious. We would love to be able to vaccinate everyone in all care facilities, all healthcare workers, and all Albertans. And we'd love to do that immediately. The reality is that it's going to take some time, primarily because of vaccine availability. In the meantime, we will continue to push hard to roll out vaccine as it becomes available. And I want to sincerely thank all of AHS staff and teams for pulling out all stops and ensuring as many people can be immunized as quickly as possible. Thank you.
Thank you, Dr. McDougall. We'll now go to the phone to take questions from callers on the line. If you can please state who your question is for. Operator, you can put the first caller through. Thank you.
Thank you. The first question is from Sarah Comedina, Global News.
Hi, this question is for the health minister. I know this is obviously going to create some delays, but I'm wondering if you can tell us at what point the vaccine rollout will include pharmacists, family doctors, and other healthcare professionals, and which healthcare professionals are being considered, like are dental hygienists on the list?
Sure. Thanks, Sarah, for the question. And just to remind everybody, phase one, and it has two groups of folks. So there's about 87,000 people in Group 1A, Phase 1A, and that's almost entirely the 20,000 people who live in long-term care and DSL, the 36,000 workers there, the 11 or 12,000 people who work in home care. That's most of Phase 1A. And we've talked about Phase 1B. In total, Phase 1 is going to be about 300-something thousand people. But 230,000 thereabouts are going to be the community seniors. Community seniors are 75 and older, 65 and older in Indigenous communities. So just remembering that phase one is almost entirely the most vulnerable, and very few, admittedly, healthcare workers, but those who are at most risk of giving or spreading disease to people are most vulnerable. And so phase two, we are waiting to be able to finish the recommendations that for phase two priority groups, and then phase three we expect would be the broader rollout to the wider community. So those decisions are not finished yet, and we're also making sure that we speak to other provinces, understanding where they're thinking. There are further recommendations to be received from a group of the chief medical officers of health for all the provinces and territories. It's called the Special Advisory Committee, and for them to be able to make sure that they're looking at the data. Our focus, though, is going to continue to be on the most vulnerable and making sure that the most vulnerable are first in protection against COVID by rolling out the vaccines to them first.
Thank you. Operator, could you please put the next caller through?
Thank you. Kevin Nimick, CTV Calgary.
Hi there, this is a question for Minister Shandro. Some healthcare workers say the registration process for signing up for vaccination this weekend has been a challenge, with many unable to sign up for the available slots. Has the registration process now been fixed, and are all 16,000 slots available this weekend claimed?
Well, I'm pretty sure, last I was briefed, that there are still spots available for those 16,000. When it comes to the registration process, I don't think, Dr. McDougall, you'd be able to answer that either. I think we'd have to push that off to AHS to be able to answer. This is their online booking tool that AHS has developed. Unless, Dr. McDougall, you feel comfortable? Okay, well, Dr. McDougall, if...
Thank you for that question. The online booking tool did actually experience a few problems for a few hours last night. They were very quickly rectified, and all of the spots and availability for booking became available within that few hours. A team from the IT team, the public health team, the web comms team all pulled together to make that possible. As I left the office to come here, there still were a few appointments available over the weekend. They were filling up very, very quickly for those healthcare providers who had been invited. And I think the important thing is that this booking tool is being used right now by the healthcare workers who are eligible and who've been invited. But the plan is in the next phase, as the community seniors come on stream, they will be able to use this booking tool as well. As we said, all of any issues with that tool will have been sorted out by then. But it's been very, very effective up until this point, and as I mentioned, just a few hours of delay last evening.
Operator, could you please put through the next caller?
James Keller, Globe and Mail.
Hi there. This is a question, I guess, for whoever wants to take it, or perhaps both. Whether it's long-term care residents or healthcare workers who've already been vaccinated, how will this affect their second doses? And for the other groups you've mentioned, seniors over 75, First Nations, how long do you expect it to take that we'd essentially be back on track and back on the schedule?
Well, we do understand, as I said, that at the end, Q1 will be back on track. This is a temporary delay for the next few weeks, unfortunately. And Dr. McDougall, if you're able to answer the question, though, about the second doses for long-term care residents. Thanks, James.
Thank you very much. That will be an extremely important question to be answered over the coming days. As we understand, we only got this information today. We'll be working with Alberta Health in terms of the advice. There's clearly some people and some planned doses that aren't going to be able to go ahead as scheduled. Again, that the second doses is the one group, as well as new first doses coming on stream. So we'll be working really closely with the Chief Medical Officer of Health in terms of getting the policy advice on how exactly to weigh out the risks and benefits of the options involved in which doses to go forward with and which ones to actually delay until we get the next supply coming in.
Hey, thank you. Operator, could you please put the next caller through?
Lauren Boothby, Edmonton Journal.
Hello, this is for the Health Minister. Do you regret not holding back the second dose as was initially planned for the priority groups? And can you also clarify what you do know so far about the adjusted timeline for everyone and who's still going to be getting it that thought they were going to be getting it in this first round of the rollout?
Sorry, the second question, do you mind repeating that second question?
Yeah, sorry. Can you clarify the timeline that you have right now sorry, I'm hearing it echoes. Can you clarify the timeline that you have right now for the first priority group?
Thanks. So the first question, no, we don't at all. And I know that over the holiday season, when the vaccines first arrived in mid to late December, and we started our immunization program in Alberta, the shipments were not arriving necessarily always in a very predictable way. And so those early days, sometimes there were days when doses were held back just in case, so we knew that we had some certainty of when the Pfizer shipments were arriving on a weekly basis. So that was the case back in December. We don't regret that decision now. We communicated and very clearly needed to get vaccines out as quickly as possible, especially to long-term care residents and the staff who work there. That was a priority for us. And the folks who work in the ICUs, including the respiratory therapists and the ICU, other healthcare workers there. That was incredibly important for us to get those first doses out and get as many first doses as we could out the door in December and in January. So we don't regret that decision at all. Now, I think this does highlight that sometimes with the stresses on global supply chains, with demand being high on all of the approved manufacturers, that we have to make sure going forward that we understand the risks of shipments being disrupted. But the Pfizer vaccines are still arriving on a weekly basis. Moderna is still arriving every 3 weeks, 16,900, until the end of February, when it'll increase, I think, to 24,000 or 25,000. So we don't regret that at all. Clarifying the timelines, none of the priority groups of phase one, A or B, is being changed. That's very clear. We know that there are going to be some appointments that might be postponed, but they're still in phase one. And the priority groups in phase one stay the same, and those folks are still expected to get their vaccinations by the end of Q1, at the end of the first quarter of this calendar year. So, but this is going to be a temporary delay for those folks in February, but we will make sure that those people are going to continue to be in phase one, and they will continue to be a priority for us getting the vaccines to them.
We have time for one more question. Operator, could you please put the final caller through?
Yes, Jason Herring, Post Media.
Hi there. I suppose this question is for Tyler Shandro. I'm wondering if you can shed a little bit of light on the confusing timelines for vaccinations for the general public. When Premier Kenney first announced vaccinations, he said general public would get them for the summertime. Online on AHS's website, it said in the fall. Then, the province said Kenney misspoke when he said it would be in the summer. And now Kenney on Facebook Live the other day said it will actually be in May or June that we have vaccinations to the general public. So I'm just looking for a little bit of clarity on what the timeline actually is here.
Well, look, and I'll try again to repeat myself, but at the end of the day, who tells us when we get vaccines and how many we get is the federal government, right? So oftentimes the production schedules and the delivery schedules change, and we have to operate on the best available evidence or best available information that we're getting from the federal government, and so sometimes those dates and those amounts change on us. The most recent information that was shared by Premier was based on before the information that we understood today. But look, I think with the increased production, with this investment in the European facility, through which Canada receives its vaccines from Pfizer, is potentially good news that by the end of Q1, the production schedule could be increased by Pfizer from the information we get. But at the end of the day, it wasn't Alberta who purchased vaccines. Alberta is not in control of the delivery schedules. We are told this information by the federal government. We will continue to share that information with Albertans when we get that information from the federal government.
Thank you, Minister Shandro, and thank you everybody on the phone for joining us today. This concludes our news conference.
Thank you.